Hi everybody, today I just want to talk about some muscle imbalance around the hip. Now quite commonly there's some issues, for example greater trochanteric bursitis of the hip, which is side hip pain, or some people get iliotibial band friction syndrome, an issue of the side of the knee, caused by imbalances around the muscle of the hip, and I'll explain about the anatomy of those hip muscles. Okay, so first we're going to look at the balance between your glute medius and tensor fasciae lata. It's a common imbalance that occurs in people's hips. If this is weak, quite often this becomes overactive. This muscle, tensor fasciae lata, you see it tracks into the iliotibial band and it goes right down to the knee, from the hip to the knee. So when this has become overused, sometimes you get issues of discomfort of the side of the knee, iliotibial band friction syndrome, or you can get like a bursitis, the side hip pain, when people lie on their side. And often people roll and massage this muscle, but I think a more important time is to spend time strengthening this muscle, because if this muscle is stronger, that other muscle doesn't get as tight. So glute medius, which is a deep side glute muscle, is a very important stabilizer muscle of the hip joint. Okay, so one exercise to strengthen glute medius is a glute bridge with a band to bias pushing out to the side. Now Akshay is demonstrating today. He's a physiotherapist as well, so thanks Akshay. So what we're going to do now is, you can smile if you like. One of the basic exercises we're going to go through is a glute bridge with a band to help to bias both the glute max, the main glute muscle, and also the side glute that we're after too. So firstly, a lot of people have underactive glutes, so we have to wake up the gluteal muscles first. Key thing is to make sure the feet are pulled back. If the feet are too far out, that tends to bias your hamstring muscles, that can be a little bit under tension. What we need to do is firstly drive through the heel, so push down through the heel. Lightly just draw your belly button towards your spine, because the hip needs spinal activity to improve the nerve flow into the gluteal muscle. Then we can push down and through the heel, tummy in, and you can just do a light separation of the band there. So light separation, then pushing up for us now. That's it, and driving through there, coming a little bit higher. Now often what I do is get the patient to hold on to their own glutes, and I tell them to wake up their own glutes, so we need to have that mind-body connection, and come a little bit higher, and then come down again. Okay. Now I just do have the band a little bit lower than normal, just so to prevent friction over the hair. So I'm bringing it up a little bit for better leverage, without causing friction over the hair. And so there's different bands we can add to change resistance, or we could change the angle again through here. So again, pushing down through your heels, suck your tummy in, and driving high to the sky, so up we go. Hands on your bottom muscles. So it's going to work, I'll show you in the diagram, it's going to work your glute maximus and medius. So it's going to work both of those, but by pushing out, we'll target the glute medius, the side part of the gluteal muscle there, and coming down. So progressing this exercise, there's a few ways we can progress the exercise. So we can go from a red band to maybe a green band or blue band. So increase the resistance of the band to make this harder as we're pushing up. Another thing we can do as a progression is add a little bit of light weight through the front of the hips there and pelvis. And it's called a hip thrust, so we can add a little bit of weight to get some more loading of the gluteal muscles. And that's kind of the first kind of phase of gluteal strengthening. There are other ways we can target that side glute a little bit harder. Okay, another exercise that's really good to work your glute medius is what we call a sideline abduction, which is in this position here, taking the hip out to the side. But a lot of people do some things that make it correct. So if we go straight out to the side, we don't quite know if we're biasing this muscle here or this muscle here. So quite often this muscle is overworking. So there's a few techniques we need to do to help to improve the bias between this muscle here and this muscle here. Because if we do the exercise, this muscle is working, it's actually often going to make a problem worse rather than make it better, strengthen this muscle here. So what we can do is we can rotate the pelvis forward, okay? And by rotating the pelvis forward, it works the glute a bit better, partly because your glute's an extensor of the hip, and tensor fasciae lata is a flexor or to bend it up. Then we can draw the belly button towards your spine. We get the patient to hold on to that part of the glute so it has that better mind-body connection. And then we can slowly take your hip out to the side, but keeping that pelvis rotated. And we can go up and down through here. You can feel that. You feel that actually? Yeah. Another little trick you can do to make it a little more challenging is to get a slight external rotation of the foot. So we slightly external rotate the foot as we rotate it forward, that's it, and then we're coming back into abduction and extension. And again, we're really feeling that targeting and through here, that's it, and you're really working that muscle through there. Okay, so muscle balance of the hip. Okay, another option is, which is a more progressive option, is lying against the wall like so. Again, tummy in, a slight little rotation of the pelvis forward to bias extension of the hip. Then we can take the foot up with a sock on and actually slide up and down the wall, pushing back. And then again, have the patient have their hand on the glute with the tummy in, pushing up and down and really targeting that side glute. It's another option for you.